Hiya, Hannah here from DVBP. I just thought we could have a quick discussion on a very large subject, which isn't quick at all. Separation-related distress. I had a recent discussion with a vet friend about it, and I thought, might be handy to share some tips. So basically, if a client comes into you and they report that their dog has separation anxiety or whatever they want to call it, or they've read about or heard about, or the neighbours are complaining because the dog is making noise, or the dog is destructive in the home, so ruining things in the house, or chewing or toileting when they're gone, or howling, or anything really extreme. They're extreme examples. That's when the client comes into you and asks for help. Please just immediately refer them. It is a massive issue. It's a welfare issue for the patient, for the dog, and it's a massive issue for the clients. I mean, a lot of our clients we work with these issues have felt like they are prisoners in their own home. They cannot go anywhere. Some of them can't even go in the bathroom by themselves without the dog following them. And if they try and shut the dog out of the bathroom, they get all sorts of issues. So this would be lovely if separation-related distress was solely down to a dog being a bit bored. It would be very easy to solve and cure, but it isn't usually. I wish it was. It isn't usually that at all. There are a variety of reasons that this happens. Some are to do with attachment, so the dog being attached to perhaps a person, an individual, or another animal, or something along those lines. It could be to do with not liking the place they are left in, or being fearful of confinement, or resenting confinement for previously learnt things, or multiple reasons for that. Or it could be potentially something traumatic has occurred, like someone breaking in when the dog was home alone, fireworks going off when the dog was in that room alone, something happening at night time when the dog was in that room alone, so therefore they then fear that room. Again, a learned component to it. Or my point is there are so many underlying potential causes for separation-related distress, and you will have heard this kind of statistic probably anyway, but in case you haven't, it's thought that probably about 80% of our pet dogs have a form of separation-related distress, meaning that there are parts of being left alone or left home alone or what have you that they don't particularly enjoy and wouldn't choose, but they aren't picked up on, and the owners don't know about them, the caregivers don't know about them. Hello. And it isn't known if it's not severe. So usually the dog just doesn't eat their treats when they're left, or they feel like the dog just waits at the door when they're gone, or when they come home the dog seems okay, so they think it's okay. The best way to know how your animal truly is when you're gone is to have a camera on them. And are we looking at a dog that's laid on their back with their legs in the air, totally comfortable and happy and snoring and relaxed, and they've eaten all their treats you've left them and they're really happy, anthropomorphizing, or content, relaxed? Or is there a dog that's laying there looking asleep but not, because every noise they're looking up, every movement they're looking up, Are they pacing? Are they looking out the window? Are they worried, too over their threshold to eat their treats you've left? Do they bark at certain noises? You know, lots of things to tease out and decipher there. And that dog might go, you know, its whole life, 13, 14 years, with hating that, but the clients have no idea because the behaviours aren't extreme enough for the client to be aware or to want to do anything about. So back to my point. My point is it's a serious problem, and it usually takes a lot of working with. So when we work with clients, there is no quick fix for separation related stuff. And when we work with them, we usually work with them for a prolonged period, because you have to get it right. And we tease things out, and we have the use of psychopharmacotherapy to help us, and we change all sorts of things in the home if needed, once we've assessed it and looked at it in complete depth. And we then work with them on a treatment, and we work with them, and we stay in touch, and we see them multiple times, and we even see them for follow-ups, because you've got to keep this, you know, you've got to keep it right. So what can you do if a client comes into you and says, my dog is displaying separation anxiety, separation related distress, worried when I'm gone, causing issues when I'm gone, won't let me leave, you know, things like that. What can you do? The first line, the absolute behavioural first aid is, please do not leave that dog alone. So use, if you can, friends, family, neighbours. Take your dog to work if you can. If your dog's comfortable in the car, take them in the car with you. If the cafe or shop or pub or wherever you're going is dog friendly, and if your dog can cope with that and enjoys that, try and take your dog with you. See if a neighbour can come and sit in while you go out. See if you can find a dog sitter to stay in while you go out. Anything like that. And worst case scenario, if you really, really, really have to leave, like, you know, a medical emergency, and you cannot find anyone else to help you in that moment, then you need event medication on board to at least help them with that situation. So the major part is stop leaving them for now while we unravel everything and work with it, because the more you leave them and the more you continue to repeat that behaviour, the more they will learn to hate being left. Again, anthropomorphizing, but making things worse. And if they really find it distressing or panicking or horrible, then you are making the whole situation worse, not better. Some people follow particular tips about desensitizing them by repeating pre-departure cues. Whoops, there's a hole in the field. This can have a part in separation related stuff when you're helping treat it, but it isn't the absolute treatment be all and end all, because like I said, there are multiple different underlying emotional motivations for particular individuals to dislike being left and being alone, and you have to find out what that individual's problem is first before you can create a bespoke behavioural modification plan, BMP, which is what we call it. So my point is, the treatment is not all the same for these dogs. So you know where we are. We have spaces. We are there to help your clients. Please, if they come in with that issue, refer them straight away, and please ask them to not leave them in the meantime till we've seen them. Thank you.